Okay, good afternoon, moderators. Good afternoon, ladies and gentlemen. My name is Glory Philemon Bebia, and I'm presenting on the topic hand hygiene and the hand-mind connection, assessing practices and bacterial contamination among secondary school students. So from today's topic, we're talking about wellness. And then from my topic, hand hygiene is also connected to wellness because if you have a good physical well-being, invariably you have a mental well-being. And this takes me to the next slide, statements of the problem. We know that contaminated hands are one of the most common modes of transmission of microorganisms responsible for infections in healthcare, food industry, and public places. And then we know that we're in the post-COVID era, and then we are still talking about the COVID-19. This in turn shows that hand hygiene practices and the associated knowledge are critical measures to control the spread of infectious agents. And knowledge of hygiene practices and hand contamination with infectious agents will facilitate risk assessment for predicting potential disease outbreaks. The aim of the study was to assess hand hygiene practices and bacterial contamination of hands among secondary school students in Calabar. And the specific objective included the determination and prevalence of hand contamination with bacterial organisms among study students, and also to assess the knowledge and level of hand hygiene practice among the subjects. It was a cross-sectional study, and it took place in a secondary school in Calabar. Ethical consideration was obtained, and then questionnaires were distributed to study participants. The sample size here was 384, but due to lack of funding, it was actually reduced to 100. Materials and method. It was simple. Sterile swab stick was used to emulsify. It was emulsified and used to swab palms of students after break. We did it years after the long break. Then following bacteriological processes, it was cultured on two media, blood agar, and then maconche. Okay. Incubated, and then after 24 hours, colonies were read and other biochemical tests were carried out on it. Statistical analysis were also obtained on it. Then results. Out of the 100 students that participated, all hands had one or two bacterial contamination. As we said, so for both male and females, they were contaminated. Age group, according to classroom, there was no statistical significance because they were almost the same number. Then distribution of isolated bacteria on hands. Okay, so for some participants, we recorded Staphylococcus aureus alone, about 7%, coagulase negative staphylococci alone, which amounted to 52% and was like the highest prevalence in this study. E. coli alone 4%, Klebsiella species 3%, Bacillus species 5%. And then we recorded the fact that one or more organisms were present on some participants' hands. And these included Staphylococcus aureus and coagulase negative Staphylococci, which was the highest, about 12%. Then now we talked about the knowledge of each participant. From this table, it is shown that students had good knowledge of what hand hygiene is all about. Because there was a question here that asked, how often Okay, this has to do with Okay, this has to do with the level of hand hygiene. Sorry, please. The level of hand hygiene. And here, there were statistical significance of some questions that were asked. For example, how often do you wash your hands daily? Many of them wash their hands less than 5 times in a day. Okay, so when do you usually wash your hands? And then some said before eating, some said after toileting, after playing, after coughing. Some did not even wash their hands after those exercises. Then I move further to the next slide, which says the knowledge. When we asked about the knowledge of hand hygiene, it was obvious that many students knew what hand hygiene was, but unfortunately, they did not stick to hand hygiene practices because it is from my slide, it said, do you believe dirty hands can spread can spread diseases? And many of them said, yes, they do. And it was statistically significant. Discussion. The study recorded an overall prevalence of 100%, okay, which aligns with the range of 93 and 95% findings from Jamikalaje in Delta State and Kenneth. And then showed that this student had an overall contamination of 93 and 95% of contamination, respectively. But however, it was markedly higher than that reported in India, which had a prevalence of 64%. And from our studies, it was seen that we had 6 genera of microorganisms isolated. The subject demonstrated fair knowledge regarding awareness of bacterial contamination, as seen that 80% were aware. And it was also in tandem with Gawa and Danjan, who had 81 and 69% of awareness of, that's a good knowledge of hand hygiene. But findings from my work also demonstrated lack of hand washing materials, limited the respondents' hand washing practices, as 75% of respondents cited a lack of hand washing material. This is in tandem with Otto et al. 2022 from Southwest, who also said that students from that secondary school in Ekiti State also had inadequate hand hygiene supplies as the reason why students failed to wash their hands. Conclusion. The study found an absolute level of bacterial hand contamination among the study participants with potential for infectious disease transmission in the students' population. Students showed good knowledge of best hand hygiene practices, but inability to conform with such practices due to lack of hand hygiene supplies. Provision of adequate hand hygiene materials in schools for student use would likely enhance good hygiene practices and contribute to reduction in the transmission of infectious diseases in the student population. These are my references, and thank you very much for listening.